Deputy Gilmore. I want to pursue this issue a little further with the Taoiseach, not least because Loughlinstown Hospital is located in my own constituency. The county coroner was examining the case of 16 deaths. 5 of those, he said, were caused. The direct cause was the C. diff infection, and another 5 was it was a contributory factor. Was his conclusion. Now, Loughlinstown is not the only example of this. As Deputy Kenny has said, we had earlier this month the report on Ennis, which showed that of the 46 cases that were looked at there, 15 were as a result of hospital infections. We're talking here about people dying. I mean, people go to hospital to get cured, not to get killed. The total number, there was a report last year from the Health Service Executive which concluded that 1 out of every 20 admissions to hospital end up with a hospital-related infection. 1 out of every 20. That's 30,000 in a year. 600 a week. Over 80 a day, people getting hospital infections. That's an epidemic. Now, we know from what the medical people in the hospitals have been saying that they have sought help with it. One common thread running through all of this is that the medical people in the hospitals flagged the problem some time ago and went looking for help. They did so in Ennis. The consultant, Mr. Hennessy, said that it was a result of overcrowding in the wards and looked for help on that front. In Loughlinstown, on 5 different occasions, the medical consultants in the hospital and the medical staff, for whom I've enormous respect, said that they wanted a consultant microbiologist. The coroner, who examined this over a 6-month period, repeatedly supported the call for the appointment of a consultant microbiologist. The problem they have in Loughlinstown is that they can't do the swabs. And they can't do it because of the absence of a consultant microbiologist. And because they can't do it, they can't even tell people whether they got the infection in the hospital or whether they're bringing it into the hospital. Now, the solution has been there for some time. It's as far back as 2005, the first request was made for the appointment of a consultant microbiologist to deal with this. And I don't accept the answer that this was all held up because of negotiations on the consultant's contract. Can you explain, Taoiseach, why wasn't the consultant microbiologist appointed? The HSE said that there are difficulties with the appointment of a microbiologist. What are the difficulties? When will a microbiologist be appointed in Loughlinstown so that at least in this hospital the problem can be got under control? First of all, Dr. O'Shea looked for a microbiologist. He wasn't trying to explain the problem away. And Dr. O'Shea and his colleagues in the hospital are doing their best to get the problem under control, and I think we all acknowledge that. The Taoiseach's argument that, you know, if you'll still have hospital infections even if you have microbiologists is a bit like saying people still get sick after they visit the doctor. I mean, that doesn't get us anywhere. The fact is that the medical people in that hospital concluded that what was required was a microbiologist. And they looked for a microbiologist, and they did so 3 years ago, and they repeated that. The request came from the medical consultants, it came from the hospital management, and it was supported repeatedly by Dr. Geraghty, the county coroner, who had the task of examining the deaths that occurred because of the problems that occurred there. Now, I don't want to lecture on the generality of, you know, the relationship between a microbiologist and the level of infection that you might or might not end up with in the system as a whole, nor do I want a response based on the number of consultants that are going to be employed. I have 2 specific questions, neither of which you have answered, Taoiseach. One is, Why wasn't a consultant microbiologist appointed to Loughlinstown over the last 3 years? And secondly, when are we going to get a microbiologist? That's what people out there who have relatives being admitted to that hospital or who are being admitted themselves want to know. Why wasn't this appointment made? Why have we had 16 deaths, 10 of which are related to hospital infections, either brought into the hospital or contracted in the hospital? And when are we going to get a microbiologist to help the people in the hospital to deal with the problem?